So, I'm asked from time to time, what would I do? Would I sign up for hospice? What kind of care would I want if I was given a terminal diagnosis? Some families will even say, you probably would want everything done. And I'll explain my story, with them, because I think it's an entry point where I can describe to them sort of what I as a doc would want. Certainly, we know there have been some interesting studies that have indicated that physicians, when they're faced with their own mortality, are very specific about making some choices to forego many of the things that we subject sometimes our patients to in the hospital. So it's not uncommon for doctors to say, not me, I don't want to be in the ICU. If I if I have some terminal event, don't send me to that ER, don't intubate me, don't start CPR, allow things to happen in whatever way they're meant to be. The paradox for physicians that care for patients is that while it may be okay for me to say, I don't want those aggressive measures performed on me as a person, me as a physician, but I am going to suggest or recommend those or discuss those or not discuss those with my patient and be honest with the patient in terms of the trade-offs that they're likely to experience. We know that the paradox for physicians is sometimes having that personal conversation with their patients feels like they have either betrayed their patient, that they're not intelligent of a physician to be able to figure out some workaround, some other alternative treatment, that they in some level have failed. Saying to a patient, I have nothing else to offer you, or we've maximized all forms of treatment, or there is another form of chemotherapy, but I really don't believe that it is in your best interest to pursue that because I think the trade-offs in your current state are too great. I think that's hard for some physicians to say because patients on the other side are coming to you as the physician to get help, to sort of help them through whatever it is disease they're struggling with. And I think that, the question sometimes becomes, how do I really know that maybe this additional chemo might help in some little way prolong the patient's life? But it is interesting looking at some of the data, some of the science that has been published, some of the reports, some of the editorials, that physicians, when faced with their own mortality, are many times very specific and unlikely to choose some of the things that we commonly talk to our patients about as choices for them. I'll share a story because I think it reflects the conversation that I'm known for having, or conversations that I'm known for having. A couple of years ago, I was diagnosed with prostate cancer. And, I was in my late 50s, and we do a yearly retreat, my entire family, to Cape May, New Jersey. During one of our times when we were alone, the large family, I started my conversation with them. None of them, except for my wife, really knew what was going on. And I had the conversation. The conversation sort of went like this. Unfortunately, guys, I've been diagnosed with prostate cancer. I have some wishes. I have some needs. I have some goals that I want to have you honor. And these are what I would not want to be done to me. These are things that I would be accepting of, but I need you to know that these are important to me, and I would hope that you would honor those. So we've continued to have conversations because it's sort of a dynamic process, our lives. We never know what's coming around the corner. And I think having a conversation late in the game is hard because it puts families in a very, very difficult situation, having to make decisions for their loved one, sometimes in an emergency, because they don't remember having had a conversation where dad or mom expressed their wishes. So one of my pet peeves is making sure that folks earlier in their lives have, or at least begin to have, the conversation. Doesn't mean that it has to remain etched in stone, the first conversation, but over time it may be movable, but at least your family has a better idea. If something unforeseen were to happen, they really know what really dad wanted. They don't have to speculate. They have an idea, and they can then sort of follow that through and honor your wishes. So during the conversation at the beach, my kids, I went through the laundry list of things that commonly are asked when people either complete a post form or a living will. And I went through the list, and my family, some of them were taken back by some of my choices, my decisions, but at the end of the day, I think they were respectful. So the list sort of that we went through looked something like this. Would I want CPR? Would I want somebody, if my heart stopped, would I want somebody to try to revive me? My decision was that if something unforeseen happened to me and my heart stopped, I would not want to alter the course of what was supposed to happen at that event. Would I want a breathing tube put down my throat to breathe? So because I wasn't going to get CPR, I didn't want them to do that either. It just didn't make any sense to do one without the other. Would I want a feeding tube if I was in a situation where I could no longer take nourishment by mouth? Again, I said I would not want a feeding tube. I know what the pros and cons of a feeding tube would be, and if I'm in that situation where that's the only alternative, I would want, nature to take its natural course. Would I want other heroic surgical measures? Again, I ended up saying, if during the time of my prostate surgery there's something else that they feel could be viable to be done surgically, certainly they could try that. IV fluids, we talked about IV fluids. I said that temporarily they could start an IV if they felt that there was some value for a short period of time, but after that, if there really wasn't any significant benefit, that would be discontinued. Again, my feelings are not necessarily the feelings of everyone, nor would they have been the choices that my family made. I think at that moment I was looking at the inevitability of what might catastrophically happen to me in that time. I haven't changed my living will, my advance directive, but I think many people do. Many people go through a difficult time and sort of come out of that and feel as though maybe they would make some adjustments to their post form or their advance directive, one way or the other. I know patients that originally had wanted to have aggressive antibiotic therapy or aggressive CPR or intubation. They went through it. They luckily got to the other side, made it through their CPR, made it off the ventilator, but they then decide, I don't really want to do that again. I'm okay with changing my post form or my living will. Circumstances in my life have changed.